Welcome to Grow Them Right, podcast where we discuss how to prevent health issues from infancy. I'm Dr. Roche, a dentist and a mother of two. As a dentist, my expertise are in oral health, and I'm committed to continuing education. I also have a keen interest in preventative health. So in this podcast, I ask questions of experts, explore their insights, and discuss practical tips on how we can help our children grow healthy and strong right from the start. The whole idea for this podcast is to elevate the conversation and allow you, the listener, to make more informed decisions. I need to emphasize that these podcasts are not a substitute for medical advice. If you have any specific health concerns for you or your loved ones, please speak to your own medical professionals. I hope you find this space useful, and if you do, please take a second to subscribe and share with your friends. And together, let's grow them right. Children's vision and eye health is of paramount importance to their well-being, growth, and development. To discuss how we can help our children retain their healthy vision, I'm joined by Dr. Jo Black. Dr. Jo is a consultant ophthalmologist with subspecialty training in pediatric care. She has worked and studied internationally and is currently the head of the unit at Women and Children's Hospital in Adelaide, South Australia. Thanks for joining me today, Dr. Jo.
Pleasure. Thank you for inviting me.
So you're a pediatric ophthalmologist.
Yes.
And you see babies.
Yeah, I see people of all ages, shapes and sizes actually. But yeah, sometimes they come to me, very fresh, very young. Yeah.
And what brings a baby to you?
The most common reasons I'll be referred a baby will be, often it's because there's concern that the eyes are not straight, that the baby's going cross-eyed. So that's a really common reason for referral. Another reason for referral might be the baby doesn't seem to see well. We see that occasionally. And then lots of other things where things don't look right in the eye, particularly changes in pupils can be significant in a baby.
So that means like the pupils are two different sizes at one given time?
or a different colour. Yeah, so that's actually a really important thing that GPs and neonatologists and paediatricians always check for. Pupils are really important in babies.
You mentioned that the baby seemed to not be seeing well. How did the parents or the medical professionals pick that up?
Yeah, so parents will often just notice that the baby's reached 3 months, at which time you would hope they would be looking fairly reliably at things that they would be interested in. And parents just notice that they're not looking at things, not looking at their faces. Often for a baby, the most interesting thing is their parent's face. So that's often is a clue for parents that babies aren't seeing much. But also, babies will look at their hands at a fairly early age. That's often something quite interesting to them in those first, I don't know my milestones off by heart, but maybe 3 to 4 months, they'll often start looking at their hands. They won't look at things that are far away. Parents can't expect them to do that, but they will start looking at things in their close environment. But something that's even more significant, which gives doctors concern and parents are often not particularly aware of it, but it is unstable eyes. So it's called nystagmus, where the eyes actually wobble. And if you have a baby who's got that and they don't seem to be looking at things, that's definitely a reason for us to have a look-see, because that can be a sign that there's an issue with vision. Sometimes the vision is totally fine as well with nystagmus, but that is a reason that they'll be referred.
And there's great variation in what time or at what age children or infants start to kind of give eye contact or look at things more intently. Is that correct? So not necessarily everyone needs to be worried about, if immediately a child isn't doing all those.
That's right. You don't want to start, getting too anxious, particularly as we were talking about before with worrying about eye contact, because as I was explaining before, I think sometimes for babies, avoiding eye contact is a kind of communication in itself, because babies can't tell you to get out of their face or they can't walk out of the room, can they? So that's sometimes the best they can do. So yes, it's nice to see that eye contact, but there are other things that babies will look at, but you remember that they won't look far. Don't expect them to necessarily look at something that's interesting far away. But yeah, there will always be variation, like with all the developmental milestones, there will be babies. And sometimes we see babies that are really, really beyond the normal milestone expectation. And it's literally called delayed visual maturation. Sometimes it's really it just, they're just a little bit late, and it's okay. We check them and everything's fine.
And they catch up eventually.
And they catch up. I see them a few months later and they're totally fine. And that would be particularly more common where you've had babies who've had a lot of ill health. That might hold up.
The energy has been spent elsewhere.
Yeah.
Right.
Yeah.
So let's go back. Tell me a little bit about you.
About me.
What do you do?
What do you want to know?
Who are you?
Okay, so I suppose I'll talk about my professional role. I really like that I actually do see people of all ages. I sometimes will be in surgery and the one patient is this size and they're 6 months old, and then the next person is 100 years old.
Yes.
And I love that. And so I speak to all generations and ages of people, and I love that. But my favourite part of what I do is working with the children and the families.
Yes.
That's a lot of fun. There's a lot of energy, and that feels like really meaningful work to me, to be able to help. Because my job really as a pediatric ophthalmologist is to do what I can to help a child develop normal vision that they then go forth with the rest of their life with the best possible vision that they can have. That's my job.
Yes.
So I'm often discharging kids at 7. I say, yep.
You're done.
Off into the world.
Job done.
Yeah.
Mission accomplished.
Yeah.
That is really rewarding.
Yeah. Yeah, that is nice.
Why is vision so important? I mean, it's kind of stating the obvious. We kind of know.
I actually always slightly stop myself over talking up the importance of vision, because I also see people who are visually impaired and sometimes severely visually impaired and who have very full and meaningful lives too. So I don't like to talk that down too much. But we know that, it's easier. There's a lot of things that are easy if you can see. Education, a lot of careers are a lot easier to do, obviously driving. I think vision is the sense of kind of independence, isn't it? And that's, again, when I'm seeing people at the other end of their life and they're losing their driver's license, it's a real loss of independence for them. So I think as parents, we do what we can to help our kids the most options that they can have in their life. So a full education is certainly going to be a lot easier with good vision.
Because a child that can't see properly, that impacts their behavior, perhaps even at school. Is that a reasonable statement? They might become more exhausted or more exacerbated, and they might show that in a way that one doesn't think that is related to their vision, but it's actually that this child can't see.
I think that it is worth keeping that in mind. I find that teachers and carers are very alert to that possibility.
Yeah.
And it is often the first thing that needs to be checked if a child is not performing as everyone hoped in the classroom. It is definitely worth checking, because they might just not be able to see what they're being asked to read. The other, if I could go back to what we do, actually a big part of my job is also helping children to develop good vision in both eyes, because and this is really a huge part of my job, one of the things, and I think it's important for parents to be aware, that if a child has poor vision in one eye but good vision in the other eye, they will not look like a child with vision impairment. They can be blind in one eye.
Wow.
And the parents may not know.
Oh, wow.
And so the way, for many of those kids, the only way you can find out is by testing their vision. So that's why really, and children won't tell you. They're endlessly adaptable, as we know, and they probably just grow up thinking everyone has one good eye and one bad eye. or they might have never closed one eye and noticed that that eye doesn't see. So it is really important that we actively test children's vision.
Wow.
And ideally, we would have a really comprehensive vision screening service.
Yes.
And across the states, we vary. In South Australia, our screening service has dwindled a bit in recent years, and we are trying to reinvigorate that. So I think it is an important message that I want to get to people is, yes, we are coming with a comprehensive vision screening service, but in the meantime, if your GP hasn't mentioned it, or if your CAFS nurse hasn't mentioned it, or if you haven't taken them to an optometrist, it is a good idea to actually actively take your child to get their vision checked before they start school. It's easy when they're about 5. We aim to be able to do it in the 4-year-olds, really.
Okay.
Even 3 would be better, but they're very difficult to test at that age.
So for parents who want to, do the right thing and be conscientious, you recommend that they start at age 3? Or
not
even
many
sooner?
people can check vision in a 3-year-old.
Yes.
If I would say, I tell my families that if they're at higher risk, perhaps try and get them checked as a 3-year-old. But often those people need a really specialist examiner. By the time they're 4, they're much, much easier to check their vision. And you will get, it's still nice and early. You can still work on that vision loss that's in one eye.
We also talked about a deviation of eyes. Like you pick that up in an infant. What do you do for that? And is there something to be worried about?
I don't know you need to worry about it, but it is important.
Yes.
Yeah, it's important for lots of different reasons. And sometimes it's a sign of something else going on. So it can be a sign of an eye not seeing well. In a young child, if both eyes don't see well, sometimes the one that's not seeing well will turn in. So it's important from that point of view. The other big part of my job is helping children to develop what we call binocular vision. So the ability to use the 2 eyes together. So that ability develops very early in those first few years of life. So it is better if you have a young child with an eye that's turning particularly in, but also an eye that's drifting out, that they get attention, so that you can firstly check the vision, check that there's not a vision issue that needs addressing, and secondly, do what you can to help them to develop binocular vision and better control of that eye, which ultimately can go on to become, quite a significant cosmetic issue as well.
Of course, yeah. And you usually do that by giving them special glasses?
Yeah, so some people, some kids, glasses will do the trick. Yep. Some kids we just monitor. If it's only happening every now and then, we just monitor and make sure their vision's developing all right. And some kids, I recommend surgery. Yeah.
Okay.
Yeah.
Is that to do with the strength of the muscles around the eye that is...
Not really.
Not really, okay.
It's really more, I sort of describe it as a small control issue. It's actually really, it's an incredibly sophisticated system that allows you to point 2 eyes in the same direction, whether you're standing on a boat, whether you're talking like this while your body moves, that you can keep your eyes fixed on an object. So it actually involves a lot of the brain in order to do that. So I always think it's just one little slip up along there where they're not just quite keeping on top of it. Those sorts of things are often run in families as well. So you'll find some families really look for it in their kids, and some parents say, well, I'm all right. Nothing to worry about.
As you were talking, I was thinking that a lot of things to do with children's health, it comes back to the mindfulness and the interaction of the parents with the children, isn't it?
Absolutely.
You were talking that, they recognize their parents' faces, and that's the most interesting thing with them. And this is where parents pick up those things. So again, goes back to being present.
Being present, observing your child and baby, and I think trusting your instinct as well.
Yes,
I think,
absolutely.
I meet parents sometimes and I say, good on you, because they were told not to worry, and they just thought, no, this doesn't feel right to me, and so they went and they asked someone else. So I do think
yes,
we
the mama
have to do that for we do, don't we, for our kids?
Absolutely.
So, yeah.
As Gabor Matter says, this gut feeling is where we got us here. That it's such an evolutionary aspect of our growing up to getting us to this point. So it shouldn't be ignored. Absolutely.
No. Even if it is your first baby. Of course, a lot of parents find it easier when it's the second and third and fourth. They've seen a lot of things before, but just trust yourself if something doesn't feel right, because timing actually is important when it comes to, particularly in those first few years of life, getting the vision developing nicely.
So important. So as the child grows into the toddler age and then, older into, preschool and early primary, is there some things that can develop in that time?
In those, 3, 4, 5, 2, 3, 4, 5 age group, that's often when a lot of this, what we call squints, the crossed eyes or the drifting eyes, that develops at that age. That's really the most common thing we see in that sort of age group. Once we're getting into the school-aged years and a little bit later, 7, 8, 9, 10, that's when we start seeing the kids coming in with myopia.
And myopia is short-sighted vision.
So the kids that do that when they're trying to see far, but they're totally fine up here, that's myopia.
Is there a way to prevent or lessen the impact of myopia?
Yeah, well, that is the big question that has a huge amount of research going on at the moment that some people may be aware of, because it was very clear that populations in Asia, across Asia, as cities became more industrialized, the rates of myopia went through the roof, such that I understand in universities in industrialized Asia, you've got 100% of young adults wearing glasses. So there has been a big research into what is it about our lifestyle that has, because it's clearly something to do with our lifestyle that has brought that on. And the science at this point points to a couple of things, and time spent outdoors is important. And it's not completely understood why that is. It seems to be more than just the fact that you're not sitting inside. Back in the old days, it was reading a book under the bed covers, and now it's on the personal screen. It's not just that, although it probably is that as well. But there's something about natural light outside, such that some schools in China are being built with glass ceilings,
Wow.
so those kids can get that UV or whatever it is exposure. So it is recommended that kids have a couple of hours outside every day. That reduces the myopia that they develop. And so probably, breaks from screens. We all know there's multiple reasons not to let kids spend their lives on personal screens, and vision is probably one of them.
Yes.
It's difficult to prove that with statistics, but it's thought that it's having some impact.
Yeah.
The other thing that's fairly clear from the big studies is that back in the day, people worried that if a child's short-sighted, you put them in glasses, all that happens is they get more short-sighted. So the idea was you're just making it worse by putting them in glasses. And many ophthalmologists believe that.
Interesting.
And then when they did the big trials, they found the opposite was true. The children who had corrected myopia progressed less. So actually getting your kid checked and putting them in glasses will protect them against progression. Yeah. And then there are treatments now that are available that are, the science is still evolving, I'll say.
Laser correction?
Or? No, you can only do the laser correction once you're an adult, once you stop growing. So it's what's happening is the child is growing. We all know that. And the eye grows at the same time. Despite the pub quiz question that says that the eye is fully grown at birth, it's not.
Wow.
Yeah.
So that's so fascinating. So the eyes are not fully developed at birth?
No, definitely not. No.
How do they develop?
Well, the baby's retina is not even fully developed when it's born. That takes at least a year or so for it to develop its final anatomy. So that's why babies actually do have, they don't have 6/6 vision or 20/20 vision.
Yes.
They actually are a bit blurry.
Mm-hmm.
And, well, beyond that, it's mostly growth during those childhood. The eye grows. Mm. And as the eye grows, that changes how the eye focuses. Mm. So if an eye grows too much, that's when children become short-sighted. Oh. So you diagnose him, you say, you meet the 8-year-old and you say, yes, you're short-sighted. And over the next 10 years, you're going to become more and more short-sighted.
So you can actually see that trajectory.
Yeah, you know that at the point when you see them when you're young, which is why there are all these interventions coming in to try and lessen how short-sighted they are. And the reason we care about that as ophthalmologists is because we know that, and I don't like to frighten parents, but the very, very short-sighted people are at risk later on in life of, retinal detachments and macular degeneration, so vision threatening problems.
Want to get on with it and seek help.
So as ophthalmologists, we feel like we're trying to hold back a bit of a epidemic there, but still, anyone who's very short-sighted will tell you that most of them would say they would be happy to be less dependent on glasses. So that's Absolutely. The win as well.
I know.
Yeah.
Yeah. It's not nice to wear glasses.
Yeah. Yeah.
Yeah. Children these days, you see infants with an iPad, sitting in their high chairs, eating, and there's an iPad going.
Yeah, it's bad, isn't it?
Not a good thing, is it, for eyes?
Well, the science is not strong when it comes to eyes, but people are, and I think that's sometimes it's because some things are difficult to prove. It's not because it's not true, isn't it? But
because it's hard to do studies in children anyway.
It is, and it's hard to sort of weed out all the different factors that go into these things. So, and to control for them, you can't. Yeah. So you can't make two groups and make
or double blinded.
Yeah, exactly. So lengthy periods on screens is probably increasing the tendency to short-sightedness. And the other thing we're seeing is the crossing of eyes, people going a little bit cross-eyed a bit more because they're spending all day focused up close, and they're losing that control that this is what our eyes do when we go from near to far. Our eyes are doing this in a controlled way. So they're losing some of that control because of sitting like that all day.
It's the ability of the eye to focus far, near, be adaptable and flexible enough to do that quickly is lost, basically. Because it's kind of in the same position all the time.
I don't think anyone knows exactly why it happens, but yeah.
So this little eye is developing. Is there any different types of food? Let's talk about food that would be good for development of the eye in the right direction. Because, back in the time, you eat carrots.
Eat carrots, yeah. My baby was orange by his first birthday, but... Okay, I have actually observed that there is an increasing number of children I'm seeing with vitamin A deficiency related vision loss.
Mm-hmm.
But it's happening in those children, often they're, autistic and living on an extremely restricted diet.
Oh, okay.
Yeah. I've seen a little bit of that. That's what the carrots are for.
Vitamin A.
Yeah.
Vitamin A.
So
the carrot is good to eat carrots.
A few carrots. Oh, you can't overdose on carrots. You might look a bit strange, but and I think it's pumpkins. Orange things have the beta carotene. But I'm not a nutritionist, so excuse me if anyone who's watching this, but so that's been a bit alarming, because I think even 20 years ago we didn't see that. Yeah, so
vitamin deficiency leading to.
But we're talking really restricted diets, kids that eat nothing but potato chips.
Yes.
Really severe. We don't see the effects of our diet really in children, but we see it in the elderly. That's when it becomes important. So everything that's good for the rest of our body is good for our eyes.
as well.
So the healthy
healthy whole
oils
food.
and colourful food and
Mm-hmm.
all that stuff helps protect us later in life.
Another question that I had was about exposure to UV, and if that's something that we need to be cautious about, and is it recommended for children to wear sunglasses, when they're outdoors on a bright sunny day on the beach, for example? Do you recommend that those sunglasses are used?
I had sons myself, and there was no way they were going to wear sunglasses and not lose them and break them. And for me, the importance of protecting your eyes from UV is to protect it over a lifetime.
Yep.
So yes, wearing sunglasses is important in Australia over a lifetime, but I don't think parents need to stress about it when they've got a little person. I think the children will end up, well, a lot of people end up wanting to wear them, don't they, in time? But when they're little, I think if they're wearing a hat, if they're happy to wear sunglasses, that's fine. But I don't.
Not something
I'm
that
often
they
telling
should
parents
nag
not
their
to
children
worry.
about.
No, exactly. Parents have got enough things to nag their children
they do.
about and worry
Yes,
about.
yes.
So I kind of give them permission not to worry about sunglasses.
Okay. That's a relief.
Yeah, exactly.
Thank you so much, Jo, for answering these questions.
That's
Is
all
there
right.
anything else that you want to add for parents, young parents of infants, toddlers that, they might want to be mindful about or do in these early years?
I guess the only other thing that might be difficult for parents to know is who they should actually
Go
speak to.
Yes.
Yeah.
Yes.
And it's not a simple, straightforward answer, but, obviously your GP is a good first person to speak to, because they'll have a good knowledge of what sorts of things are important. They would have limited many have limited capacity to actually really examine an eye or test vision. But similarly, your cath nurse will often be able to do some, vision tests and be able to advise you on what sorts of things to worry about and not. And then, of course, you've got your optometrist. And I do think optometrists work a little bit like a GP for the eye, because they're very good at examining eyes and testing vision. They're not always so comfortable with little children, though. So there's this group of professionals that probably not many people have heard of that are called orthoptists, and they are allied health professionals like optometrists and OTs and physios, and their area of specialty is testing vision and eye movements. And we do have in Adelaide at least a couple of practices where you can actually go and see an orthoptist, and they are highly skilled at assessing vision and eye movements and these sorts of issues in young children. They work very closely with us as ophthalmologists, and they are, if you can find a referral to those practices, they are someone who would really be able to give your child a really good vision assessment if you had any concerns.
Fantastic.
So
Great.
There's lots of places you can ask. Yeah.
The key message is that to become mindful, be interactive with your child, and if you see things that are not feeling so good, trust that gut feeling and seek help.
Yeah, that's
fantastic. Thank you so much, Jo, for your time today.
Pleasure.